An augmentation mastopexy, or breast lift with implants, is one of the most common operations I perform. So let's talk about what it is and who needs it. So a breast lift or mastopexy, as well as a breast augmentation, they work together to restore the youthful appearance of a breast. The implants, they serve to add volume, specifically the upper pole fullness that many women want. The breast lift serves to tighten up the loose skin as well as appropriately position the nipples on top of the implant. The augmentation is essentially the same as any other breast augmentation. The lift is where there are more variabilities. So if the nipples only need to be moved a centimeter or two and there's not a ton of loose skin, a donut lift or periareolar lift with the augmentation may be all that is needed. And if that is the case, I would perform the augmentation, make the pocket, and put in the implant through the same mastopexy or breast lift scars. If the nipples need to be moved more than 2 centimeters, then we either need to perform a lollipop or circumvertical lift or a Weiss pattern, which is also called an anchor lift. Whether or not you need one of these or the other depends on the vertical excess of your breasts, and I will determine that by doing a bunch of measurements and essentially figuring out, once we get the nipples up to the position where they should be on your chest, what will be the distance from that new nipple position down around to the bottom of your breast. And if that future length is going to be too long, you would need the full Weiss pattern or anchor shaped lift to treat the vertical excess. If you don't have vertical excess, then a lollipop or circumvertical lift will be sufficient. So who needs these operations? They are usually, I'd say most commonly, women come in and they want a breast augmentation. And unfortunately, I have to break the news that their nipples are low and they have ptosis, and that they really need a breast lift at the same time. And some people would say, well, you could put the implants in and position them lower on the chest. Well, that's not a good solution either, because you don't want your breast volume and implants low on your chest. You're better off having the implants placed at the right position on your chest to give you the cleavage and the upper pole fullness that you want, and then tailoring the breast soft tissue around those implants once the implants are in the correct position. And to get the nipples up to the appropriate location on the implants, as well as tighten up the loose skin so it's not hanging off the surface of the implants, a breast lift is needed. And which lift is needed, I explained about a minute ago. One other point I want to make is that you can always have the breast lift and augmentation performed in 2 separate stages. So if you're borderline need for a lift and you really don't want the scars of a breast lift or mastopexy, oftentimes we can perform the augmentation, and if afterwards you're happy, great, we don't need to do anything else. If afterwards you wish your nipples were a little bit higher and your skin was a little bit tighter, we can always perform the breast lift later, and oftentimes I can perform the breast lift under local anesthesia or numbing medicine only. We could also perform the breast lift first. So you could always have a mastopexy performed first and the augmentation performed later. So that is also an option. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.